Lately, I've been getting a lot of patients that are presenting to the practice, and they've spent thousands of dollars on their mouth with root canal, cores, and crowns, but yet these teeth are still breaking off at the gum line or they're getting recurrent decay. In these cases, implant solution is usually the best way. What we do differently at our office is we'll do a workup with a CBCT, which is a cone beam, and from there we'll come up with a virtual plan so that we can actually identify the key positions of bone to place implants, whether it's all on 4, all on 6, or traditionally parallel placed implants. We want to do the surgery virtually before we actually even touch the patient. Here's a great example of using guided surgery when doing a full mouth reconstruction with implants. Whether it's an all on 4 or all on 6, we'll identify the key areas of bone so that when the patient comes in for the day of surgery, not only are we taking the teeth out, we're actually placing the dental implants, and the patient gets to leave the office with a fixed temporary bridge. In this example, we had a patient that presented to our practice with severe acid erosion, as can be identified in this photo. Using guided surgery, we're able to place all the implants on the same day of extractions, and the patient walked out with fixed temporaries. Here we see the biting surface view of the same patient. Notice the erosion in the top photos, and now look at the final restorations of both top and bottom arches. For more information on full mouth reconstruction utilizing dental implants, please log on to Troy Dental Implants, and there you'll get to see before and after photos of my actual patients.